Hey everybody, happy Wednesday. This is our Wednesday Wellness Minute on talking about how chiropractic can help our kids and what we do with pediatrics. And our big topic that we've been talking about for about 2 weeks in the office is those darn ear infections. And what are they, and why is there such a difference between what we hear the medical doctor versus what chiropractors talk about? And it's just kind of comparing apples and oranges, or looking at the apple from two different sides. And what we'll talk about really quick today is there are actually a couple different types of ear infection. There's what's known as an outer ear infection, which is from the outside of the ear to the eardrum itself. And then there's an inner ear infection, and that's the really painful one. The eardrum gets all red and swollen and inflamed. But an outer ear infection, the canal that goes into the ear will get red and swollen. So you may go into the medical doctor and they'll say, yeah, your child has an ear infection, and it's on the outside of the eardrum, and they won't do anything for it, any antibiotics or anything. They'll just tell you to let it go home and run its course. Chiropractically, we would tell you that you could use some things like garlic oil, sometimes hydrogen peroxide. There's a couple different natural remedy things that you can try. On an inner ear infection, that's when they're way more likely to do something that is prescribed, because they want to help the body get its ability to beat the disease that is growing inside that ear canal. But if you notice, there's this great big drain, and that drain runs between some hard bone and the skull. And if this tissue right through here gets inflamed, that eustachian tube, guess what? That fluid won't flow down into the throat and get out of the system. So the pressure will build up in the ear way up in here, and it'll cause that eardrum to expand, get red and irritated, and that's where you can end up with the ruptured eardrum. So chiropractically, we try to get in there and cause the alignment from the bone all the way into the spine, and that soft tissue drain called the eustachian tube to flow naturally. And we just do that through some really subtle, soft manipulation and adjustments of the bones in the neck, and some soft tissue work over the throat. Some chiropractors will actually go inside and massage the tissue on the inside. Some work from the outside. But if you have more questions about this, go ahead and leave comments below. If you have questions specifically about a friend or a family member that could benefit from helping with these darn ear infections, go ahead and share this information with them. They can find a chiropractor in their area. Otherwise, go ahead and comment here, and we'll help you find a chiropractor in your area so that you can get some chiropractic care and get some relief for your kids and get some sleep at night. Thanks for tuning in. Happy Wednesday.